Hey there, parents. The BCG vaccine is a pretty big milestone for your baby, right? So, in the next few minutes, we're going to walk through exactly what it is, why it's so incredibly important, and what you can expect step by step. So, you're probably wondering, what's this all about? What should you actually expect from your baby's BCG vaccine? Let's get right into it. All right, first up, protecting your baby. Let's really get into the why behind this vaccine because it's a big one. Okay, so what is this BCG vaccine? You might hear the full name, Bacillus calmette-guerin, but really all you need to know is that it's this incredible tool we have to protect our little ones from the most severe forms of tuberculosis, or TB. And this is where it gets really important. It's not just about any TB. It's about preventing the most dangerous forms, like tuberculous meningitis. This is the kind that can affect the brain and honestly cause damage that can't be reversed. So think of this vaccine as a vital shield for their developing brain. And if you need a number to really drive this home, here it is, 47. That's huge. Unvaccinated children are 47 times more likely to get tuberculous meningitis. It just puts into perspective how incredibly protective this one little shot is. Okay, so we've covered the why. Now let's get practical. Section 2 is all about the right time to vaccinate, the when and the how. So the usual sweet spot for this vaccine is somewhere between 5 and 8 months old. Definitely no later than their first birthday. But there are exceptions. If you're living in an area with higher TB rates, or maybe you're planning a trip, your doctor might say, hey, let's do it a bit earlier. The best thing to do is just have a chat with your pediatrician. They'll know the perfect timing for your baby. All right, let's talk about what happens after the shot. You're going to see some changes on your baby's arm, and I want to walk you through the normal healing process. It's so important to know what to expect so you don't worry because what you'll see is totally normal. And this picture really shows it perfectly, right? Think of your baby's arm as telling a little story of the vaccine doing its job. Over about 3 months, it'll go through these 4 stages. It starts as a little red bump, then it might form a small blister or an ulcer, which then scabs over, and finally, once the scab falls off, you're left with a tiny scar. Seeing this whole process is actually a great sign. It means the vaccine is working. Okay, let's talk about side effects. It is completely natural to worry about this part, so we're going to break it down and look at what's common versus what's really, really rare. Now, don't let this table overwhelm you. It's just here to give us some perspective, using data from Taiwan and the WHO. The big takeaway, honestly, look at the numbers. Serious side effects are incredibly rare. We're talking just a handful of cases for every million kids who get the vaccine. So the odds are overwhelmingly in your favor. So let's break that down even simpler. There are really 2 buckets here. In one bucket, you have the common but minor stuff. Things like a little abscess right where the shot was given, or some swollen lymph nodes nearby in their armpit. Annoying but not serious. Then, in the other bucket, you have the uncommon but serious things, like a bone infection. These are the ones that are super rare and usually only happen if a baby has a pre-existing immune system issue. So let's just zoom in on that very, very rare bone infection, osteitis, for a second. This isn't something that happens right away. It could show up a few months or even a year after the shot. So what do you look for? Just keep an eye out for any weird swelling or tenderness on their little arm or leg, or if you notice they start limping. If you see anything like that, don't panic, just call your pediatrician and get it checked out. Okay, last section. Now that you know all this, what can you, as a parent, do to help? Let's go over some simple tips to make this whole thing go as smoothly as possible for your little one. These are just some simple, practical things that can really help. First, when it's time for the shot, hold your baby firmly just like the nurse shows you. They can be super wiggly. Second, keep those tiny fingernails trimmed so they can't scratch the spot. You can also cover it loosely with some gauze or just pop them in a long-sleeved shirt. And this last one is super important. If there's any history of immune problems in your family, make sure you talk to a specialist about it before vaccination day. When it's all said and done, just remember what this is all about. This isn't just a quick doctor's visit or another shot. It's truly an act of protection, an act of love for your child. It's you giving them the best possible start.